The problem is that you spend thousands of dollars, and a few years later, you're going to be wondering, hey, why am I having another cavity here?
Right.
So.
Hey everybody, I'm Dr. Alan Williams with the Grapevine Dentist.
And I'm Dr. Daniel Choi with North Texas Dental Surgery.
So I want to talk to you about a patient that came into my office this week with a large cavity on one of her molars. And so with this particular patient, we had two very different options, two different paths that we could go about treating this tooth. So today I want to talk to you about those options, the pros and cons of both, and then what we decided.
And also how it could save this patient a ton of money and grief down the long run.
So let's talk about options of saving the tooth versus the other option of removing the tooth and going with an implant. So first, this patient presented with a really large cavity on her upper left molar. The patient's not in any pain, however, there is a large hole in the back of her tooth, and then upon looking at the x-ray here, I can see this darkness, the darkness indicating decalcification and where that decay is spreading in her tooth.
Quick notice though also is that this patient already had an existing filling, right?
Yes.
So how did this even happen though?
Good question, Dr. Choi. So sometimes if the original dentist that did this filling, if they didn't completely remove the cavity that was there or left some form of decay, that decay could have spread and become this larger amount underneath that filling. Or another way of this could have happened is if that filling was not properly sealed. If without a proper seal between the filling and the tooth interface, recurrent decay is going to happen.
Right, so the bacteria goes in there and just kind of like starts spreading over time.
Exactly. Yeah. That's why coming into the dentist every 6 months, we make sure that the seal is properly sealed and that the integrity of the tooth remains strong.
Right.
So here's what we're looking at now. Cavity extends pretty deep into the tooth, almost to the nerve of the tooth. However, the patient at this point is not in any pain. What I know is that this tooth needs to be cleaned out. Once I get in here, remove this decay, there's likely going to be a nerve exposure to this tooth. What that means, Dr. Choi, is we need to go in here and clean out the roots, basically do a root canal, remove the nerve supply. After doing so, we need to talk about options for a crown. Crown is when we remove the tooth structure around the entire circumference of the tooth, shave it down, and put on a cap.
Let me ask you a quick question
Yes.
though. Like, why can't we just do like a larger filling to kind of restore it? Because you said you're gonna have to clean out all this, so now you're gonna have a huge filling here. Like, why can't we just do that?
Good question. So whenever we put in these really large fillings, particularly in these back teeth where we have a lot of heavy forces, the likelihood of that tooth fracturing becomes very high. Once it fractures, it's likely going to go down the vertical axis of the tooth, meaning the tooth has got to go. So going the fast or cheap option of sticking in a large filling is ultimately not good for the
Right,
tooth.
and after they spend all that money doing a root canal and then trying to like just do a big filling over there, it makes no sense at all.
Exactly.
Right.
So by putting in a root canal, you absolutely must put on the crown to seal this tooth. Here's what I'm looking at here. The decay reaches a point where it's almost to the bone level. That creates a problem for me as the dentist when I'm making a good fitting crown, making it near impossible. So Dr. Choi, tell me how I can put a good fitting crown on a tooth like this.
Right, so that's exactly the point. And like the other thing too is that, this is something we learn in dental school. X-rays only tell us so much. So when we were going in, we're expecting maybe to only like clean out the tooth up to this point. We know realistically that we can even have to go deeper and deeper. Right. And so, the reason being is that when we do a crown, again, the whole purpose of the crown is to be a protective envelope over a tooth to kind of redistribute the forces to protect that tooth when you're biting in hard so that the tooth doesn't just split and break. But when we're doing a crown, what we're really doing is we're shaving down the tooth and then we're putting this crown, looks like a tooth, and putting that on here. Well, the problem is where that we shave that tooth down to, if that is too deep, close to the bone, we're not really gonna be able to get an accurate, what we call impression or replication of what this tooth really looks like to make you an adequate crown. So long story short, when we put this crown on here, what ends up happening is that we're not gonna have a perfect seal, probably, most likely in this area. So we would have to do a procedure called a crown lengthening procedure where we go in, we remove some gum and bone to clear enough space around here so that I could get an accurate impression. So I know that sounds a lot very technical and stuff like that, But just know that, long story short, unless we do this crown lengthening procedure, we're not going to be able to get an accurate mold of the tooth. And therefore, what would happen is bacteria is going to seep in underneath the crown and therefore kind of rot out the tooth with a huge cavity. That's literally what we're just avoiding, right? This is how we got to this point in the first place, because most likely the dentist didn't do a good seal, and now we're dealing with this on a larger scale. Granted, you won't probably know that you have an issue, but the problem is that you spend thousands of dollars, and a few years later you're going to be wondering, hey, why am I having another cavity here? Right?
So in order for it to be successful, Dr. Choi, we would need the root canal, crown lengthening, and then the crown.
Right,
correct?
right.
Okay.
And a buildup, right?
And the buildup.
So let's now get to the meat of this whole conversation, right? Let's talk about money and how you could save a lot of money or grief later on down the road. So for this patient, who has insurance, we worked up an estimate for her. So again, what that entailed was a root canal, a crown, a buildup, and a crown lengthening. So long story short, patients interested in seeing what their copay would be. Mm-hmm. So the patient's copay in this case was $1,300.
Okay.
Now the other option that we haven't discussed yet, but is now we're looking at, okay, all these steps, and then I was also telling them wait, so you're telling me that I could do a root canal, I can do all that stuff, and it's going to be difficult for you to do a crown back here because of how big that cavity is. So now another option that we know of is that we could take the tooth out and we can just place an implant, right?
Right.
So what's an implant, right? So an implant is literally just replicates a tooth. Instead of having a root, it's a titanium screw that we place in your jawbone. And then on top of that, what we have is something called an abutment. And then on top of that is a crown. So the reason why implants are beautiful is because they don't suffer from bacteria typically. So that's another conversation for another video. But if you do have a good surgeon who pays attention to the details, and you clean your teeth and you floss your teeth, an implant should be a lifelong solution.
Yeah,
Typically, for something like this, we can't offer them and say that this is a lifelong solution, right? Where we do a root canal and all that stuff.
Right.
So an implant can definitely be a great long-term solution. So would that be a viable option in this case? Well, it would be, but a lot of times patients really want to know about what the cost would be. So in this case, with the extraction of the tooth, bone grafting, future implant, and doing the abutment and the crown, long story short, all the necessary steps that we need to do to get that implant, the cost for the patient copay would be $3,300.
Okay.
Okay, so now that,
little price difference. Yes.
Yeah, that's a $2,000 price difference.
Right.
So patients might sit there and say, well, shoot, that's $2,000. Do I really want to go down that road? Mm-hmm. $2,000 is a lot of money.
Right.
So you're absolutely right. We can always make the argument with the patient that, hey, an implant is a lot more predictable and can be a lifelong solution. Right. So that would be worth the investment. But here's the trick. I have the trick here to basically save you a lot of money. Now, what a lot of patients don't know is that when they get a dental implant placed, it's, there's multiple steps and there's time involved. Now,
takes some time.
Right. You've seen on TV commercials, teeth in a day, stuff like that, and we do offer that solution without going down that road and explaining too much. But you can get your teeth replaced and get all your teeth replaced in a day. But for single implants, typically, especially back teeth, that's a multi-month process.
Right.
We take the tooth out, bone graft it, wait 3 to 4 months, place an implant, wait again another 3 to 4 months, then begin the process of putting the crown on there.
There's a benefit to that timing.
Right, exactly. And that's the whole point of this argument. You can actually use your insurance benefits in 1 year and then use your insurance benefits in the next year also.
For the same case, same implant.
Exactly, same case. So therefore, depending on how much your insurance pays every year, you could save another $1,500 to $2,000 off the total cost. And therefore, in this case, have the discrepancy of maybe $500 or no difference depending on your insurance.
Okay.
So that would be the advantage of really going and figuring out how you can use your insurance coverage and use it over that course of time. So that basically, because we understand that money is a big determiner of which, avenue or treatment plan that you'd be interested in. But in a case like this, with the extent of decay and stuff like that, the reason what really happened was that this patient ended up selecting to go with the So hopefully you guys found that information helpful. If you guys have any questions, please feel free to come on in and fill in this, and we'll be more than happy to answer these questions for you.
Thank you guys.
Thank you.